Good evening, everybody, and welcome to the Board of Health. I call this meeting to order, a regular meeting of the Board of Health on April the 28th, and we are again remote. My name is Dr. Ed Weiner, and I'm chairman of the board, and I'm joined by David McSweeney, my vice chair, Mary Beth Welch, who is a Board of Health member, Libby Walenjevich, who is an elected Board of Health member, and I think we're expecting Wayne Salzman any minute. In addition, we have the Director of Public Health, Susan Luminello, our environmental engineer, Christine Mathis. In addition, our Board of Health clerk, Sarah Kortemach, is here to coordinate this meeting. Sarah, you are our producer. In Atlanta, lastly, we have Dawn Cathcart, who is our recording secretary. Thank you. And by remotely calling in, and I believe that Dawn.
Is anybody losing him?
Yeah, Ed, you're spinning in and out with your video and your audio.
And your audio.
Yeah.
You're good there. You go ahead. Keep going. I think you're back. No.
Okay. Can you give the legal issues that we have to go to?
Yeah, I sure can, Mr. Chairman. So pursuant
David,
to
I'm coming in.
Go ahead. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and Governor Baker's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by turning into BCAT, Government Cable Access Channel, the BCAT Government Meetings Facebook live feed, or over the phone, which is dialing 408-418-9388, passcode 717-807-119. Again, that's 408-418-9388, passcode 717-807-119. Also, we will be actively monitoring the comments on Facebook Live. Hopefully that's correct, to see if there are any that the board may wish to address from the public. And as a reminder to everybody on the board that all votes are required to be done by roll call for all virtual meetings. And Mr. Chairman, that's all I have to read.
Thank you. We'll now start the meeting with the Pledge of Allegiance. Libby, as you have done in the past two, can you please lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you very much. We are at the citizens' time. Is there anybody on the call here who would like to address the Board of Health? In hearing nobody, we can move on. Couple of comments. As you surely know, the pandemic continues and our lives continue to be different. At least they will continue to be different for the near future. So much has been canceled, important events, proms, graduations, weddings, religious services, and even funerals have all been affected. However, we need to do this to keep you and your families safe. The Board of Health has not only been working with the police and fire, but with every department, board, and committee and commission within this town. Every department head and every town employee has been working to maintain services within the municipality. Specifically, I want to thank the police chief, the fire chief, Paul Sagarino, our town administrator, most of all, the elected Board of Health who have been so involved, and our professionals. The Board of Health, Director Susan Luminello, has been working literally around the clock. She has done this since the beginning of the pandemic, and we're all doing this, as I've said many times, to keep you safe. I thank you all. We only ask that you be patient with us. We're doing the best we can to provide you the services and the support that hopefully you do not need, but are here. We'll get through this. I'm so proud of the town as we continue to work together doing what needs to be done. Whether it's tonight, tomorrow, or a week from now, if you have any questions, feel free to call the Board of Health at any time. I also add you to review our Board of Health website for regular updates or public health instructions. For the board and for everybody, I just spent over an hour or so on the phone with Amy Warfield, our town clerk. We're going to have a June 6th election, and I have spoken with her, and we will speak many times to take a look at her excellent draft plans for early voting, absentee voting, and in-person voting. I'm going to set up a subcommittee, myself and Wayne Salzman, who will be doing some work together to ensure that we have every I dotted and T crossed to make sure we have safe elections. Our next step will have to be town meeting, which will be another major endeavor. At this point in time, I'm going to ask any of the Board of Health members if they'd like to say anything. All of you who have done so much for this community. I'll go down the line. My vice chair, David McSweeney. Do you have anything to say?
No, nothing in addition, really, Ed, other than, again, thanks for coordinating these remote meetings and ensuring that we are continuing to have these meetings. I realize that even though we don't have a packed agenda, it's important that we're communicating with the community and staying active and ahead of any issues that may come up, and also giving a forum to the community if they wish to address the board formally. So I appreciate that. Hopefully that we are coming out of this, although, not to get overly, excited and/or lax in our behaviors. I do feel positive that I do see a light at the end of the tunnel, and as Governor Baker stated, they are extending the advisory to stay at home. But I feel good that we are hopefully on the tail end of this thing. So I just want to thank you for continuing and making sure that we're out in front of the citizens and giving them a forum to address the board if needed. So thank you.
Mary Beth, is there anything you'd like to add?
Hi, Ed, can you hear me?
Yes, I hear you.
Great. And I agree with your opening, and as well as David, and I appreciate the forum too. I've been receiving communications via text or emails or phone calls, and I think one of the key the constant that I hear is that there is a forum, that we have a lot of communication weekly, daily, and there is also an opportunity if the public is looking for something, to speak to someone. And I think that we're fortunate that we have a board of health. There are a lot of towns that do not, and that they share. But I've seen, what I've seen for, as you said, across our departments as well. And I think not that we weren't working closely with our departments, but I think it's brought us closer. And that's what I'm hearing from residents that have reached out to me, that we're providing information and sharing, and there's an opportunity if to contact someone live if needed. So I think that's that's really all I had to add.
Thank you. Libby, is there anything you'd like to add?
I agree with everything that's been said by Ed and by David and by Mary Beth. The one thing I would like to add is a great big thanks to the BVRC, the Volunteer Reserve Corps, who has been invaluable in their help in being runners and so forth. I think our town is well positioned to deal with issues like this, and it's in no small part due to the support that the town gets from the BVRC. All of our town facilities or departments are working together, and I think we're in pretty good shape.
Thank you very much. At the end of the call, we will thank many members of the BVRC, and so thank you so much for adding that. I'm going to ask for an emotion to please move the environmental engineer and the director of public health staff reports uh, to the next topic, so we can then spend a full discussion on COVID-19 response and updates. Could I please have a motion to amend the agenda?
So moved.
Second.
Do I have a
Second.
second? A second by Mary Welch. David?
Aye.
Uh, Mary Welch? Mary
Aye.
Beth?
That's fine.
And
Aye.
oh my gosh. And Libby, please.
Aye.
Thank you very much. So let's move on to the environmental engineer.
Good evening, everybody. So I continue to do a lot of the routine things that I would normally do, including, approvals of building construction, renovation, and demolition, septic closures, and inspections that I can do responsibly with social distancing for occupancy or opening of essential businesses. In addition to that, I've been doing quite a bit of COVID-19 related activities. One category of which has been responding to requests from the Department of Labor Standards to follow up on cease and desist orders that they have issued to certain businesses that are considered non-essential, but were operating in some capacity. So I've followed up with a number of those businesses to ensure that they're following the governor's orders on non-essential businesses. And then the other large category of COVID-19 related projects that I've been doing are to respond to and follow up on COVID-19 related complaints. And examples of those would be things like essential businesses that aren't practicing what people consider, or in their consideration, are not proper social distancing, or businesses that are open and shouldn't be, various complaints about grocery stores and wearing masks, that type of thing. So I'll take any questions you might have on my report.
Does anyone have any questions for the environmental engineer? I have one.
Sure.
We have any idea, because I get this question all the time, when our household hazardous waste program will begin again?
That's a tough one, because I had a number of people reach out asking if we were going to hold ours, the one that was scheduled for April 18th. And of course, unfortunately, we had to cancel that. And I started looking into alternatives for individuals. I tried contacting the Hartwell Lab facility that's run mainly by consortium, but mainly by Lexington DPW. They are closed till further notice. I then called Clean Harbors Fix Facility in Braintree. Their household hazardous waste days are closed till further notice. It's a tough one. Hopefully we'll be able to schedule one for our normal fall time frame, which is, late September. And we'll just have to see where we're at in the fall, but I'm hoping that's where we'll be.
Thank you very much. I
Sure.
had an idea that, as everything else, it will be postponed. Thank you so much for everything you're doing.
Okay, thank you.
Hey, Mr. Chairman, I didn't come off a mute quick enough to, can I ask a question, please?
Please, please, please.
Yeah. So, Christine, I just see this in your report. And I know I've gotten a couple of questions, and obviously I know the answer, but it would be good maybe if anybody is watching at home. Can you just talk through the procedures around, such as grocery stores and what have you, wearing employees wearing face masks and gloves? Again, I see a couple in your report, but I've also been asked or commented towards on a couple occasions about that. So maybe you just have some clarifying comments around that?
Sure.
Or if it's not you, it could be Susan or whoever, but just if somebody could comment.
No, I can start and Susan can add if I miss something. So the governor issued two sets of orders. Well, the governor issued one and DPH issued another regarding precautions and procedures for grocery stores and pharmacies. And one of those was, one condition was that they do as much as possible to protect employees in the public, to prevent the spread. And it said including but not limited to, and it went down a series of things. It did not specifically mention masks, but we've taken the approach that employees of grocery stores and pharmacies should be wearing masks, and we've seen widespread attention to that. And I have conducted several inspections, like I said, at grocery stores and pharmacies, and I've seen widespread compliance with employees at those establishments wearing masks. There's not really a directive for wearing gloves for employees, so we haven't been enforcing that. There's no requirement for that at this point. But like I said, I have been out in the public too. I think I've been to all of our grocery stores and major pharmacies, and I've seen widespread compliance with the mask wearing.
Anybody else? And we welcome Dr. Saltzman. We did.
My apologies, Mr. Chair. Late minute issues. I couldn't be helped, and I'm happy to be here with the board.
Thank you very much. Please note, the recording secretary, please note that Dr. Saltzman is here. Any other questions for the environmental engineer? Wayne, we took the two reports out of order, so we could do a full session on an update for COVID-19. If not, could I have a motion to approve the environmental engineer's report?
So moved.
Second.
And I have a second, Libby. Mary Beth,
Aye.
David,
Aye.
Libby,
Aye.
Wayne,
Aye.
and I'm aye, 5-0. Thank you. The next is the Director of Public Health, who will be reporting on both the health agent as well as the health inspector, as well as her own. Are you there, Susan?
Yes, I'm here. Thank you, Mr. Chairman. So I'll talk a little bit about what all three of those staff members have been doing. We've been doing a lot of, mainly response to COVID-19 at this point. The health agent and the associate health inspector have been trained on Maven to help out with contact tracing. So they are both doing data entry from the MRC nurses that are helping us out. So we've seen a steady flow of cases every day. Hasn't really gone down much daily yet. I think it's been probably about the same. We're going to go to May 1st, and hopefully May 1st, like I mentioned in our last meeting, DPH contact tracers will be helping us out. So at that point, the expectation is that we won't have to use as many MRC nurses. So right now we have probably about 10 or so MRC volunteers, some of them nurses. We have one physician, one physician's assistant, one nurse practitioner, and a public health person. And then we have 2 school nurses who are helping us with the contact tracing. We're getting the information from them on intake and follow-up, and then we are entering it into our Maven database. So that is right now taking a good deal of time. And like I said, we're hoping by the end of the week that we can do less of this and shift our activities into other areas. So another thing that has come up with that the health agent has been working on is the restaurants selling groceries. So the chamber reached out to us, Rick Parker, along with the economic development director, Melissa Tentakalis, and asked us if we could streamline that process. So the health agent created a set of parameters and an application form so that restaurants can apply for a permit to us quickly and get the approval quickly. So right now we have one in the works, and we're expecting that more may come forward to try to expedite this process so that they can sell groceries along with their takeout items. And most of these places, I think, put this onto their website, a list of groceries that they have available. I wanted to talk a little bit about the, actually to follow up on Christine's report, the masks. So we have reached out to our volunteers to make masks. We have gotten inquiries from the public about masks saying, can you provide us one? So that's when we decided to reach out to our volunteers. And I wanted to thank those volunteers for making masks for us. And we have some available. We've delivered some to residents, and we have gotten requests from Amy Warfield to provide those masks for the poll workers. So we will be doing that. We've also told our restaurants for their employees if they would like a mask, if the employees don't have access to a mask, we can provide them to them. So we have been trying to coordinate that as well. Any questions on my current report, and then or any questions on anything else related to the report?
Hi, Mr. Chairman. This is Mary
Please,
Beth.
Mary Beth.
Hi, Susan. I'm glad that we spoke this week. I too, was really excited to see that you have that support from the reserves for the nurses. I was really happy to see that, and hope it alleviated some pressure from your team. I saw in your report, and I knew, I think I may have had this question too. It was the letter for unreachable COVID-19 positive residents. Could you just explain a little bit more on that?
Sure.
Thank you.
In the follow-up process, we're given by the labs person's name, contact information, usually their phone number. We're not an address. We're not always given the correct information. So we call them, and sometimes we call and call and call, and no one answers the phone. Perhaps it's not the correct phone number or whatnot. But if we can't reach somebody within 1 to 2 days after several phone calls, we will send a letter to their house explaining what we want and asking them to call us back so that we can continue with the contact tracing process. And I think we've only had to do it a couple of times, and it has been pretty successful. We've gotten calls back on the 2 times that we have sent out the letter. So it has worked. I'm very proud of the job that my staff is doing, that the MRC nurses are doing. We really stepped up on this contact tracing, and I think that it is an important thing to do. It's important to get to these people quickly so we can get them into isolation and to get their contacts into quarantine. And we respond every day to everyone that comes in a timely manner, and we are not backlogged at all. So I'm really proud that we've been able to do that, and that's because of the expertise of my staff and the staff willing to help out in any way that they can, and then also to the MRC personnel who some work tirelessly. Every time I give them a call, I say, can you take a couple of cases today? They always say yes. They always step forward, and they always do it quickly. They get a turnaround to us in no longer than a day. So they're doing an amazing job.
Well, the board is proud of you and your staff and and the reserve as well too, Susan. This was jumping into all the practice for emergencies. It certainly paid off
Thank you.
all your tests. Not that you were expecting or planned for this, but I think yourself and your team have done amazing things. Thank you.
Hey, Mr. Chair.
Yes, please, David.
Yeah, thanks. Hey, Susan, just curious, maybe you can kind of talk through what kind of questions or concerns you're receiving. After we've been going through this for several weeks now, the calls probably have shifted from predominantly, how many cases or whatever in the town. And that new report that comes out by the state is great, by the way. But what kind of concerns are getting raised, or are you seeing an influx of calls on a certain issue or topics? That would be great to understand.
Sure. So recently we've had quite a few calls on the antibody testing. People want to know, where can I get antibody testing? And, should I get antibody testing? And basically what I have been telling the people that have been calling in is that there's two things to consider, and maybe Dr. Saltzman can weigh in on this as well. But one being the accuracy of the antibody test. Right now, it is not 100% accurate. That's the number one thing. Number two, we don't know enough about COVID right now to say how long the immunity is. So if you get the antibody test today, how long does that last? Is it 1 week? Is it 2 weeks? Is it 2 months? So that's something that we don't know right now, although there's a lot of value in the antibody test and perfecting that. Right now, I don't know how much information it would provide to the individual person seeking that out. So that's the advice that I've been telling them, and maybe Dr. Saltzman can add to that as well.
Wayne, do you have any update?
Sure, I can. And I think Mr. McSweeney raises a good question and a good point, because I know there's a lot of confusion regarding testing. So when people refer to testing, we need to do more testing. They're referring to a test that determines how much virus is in the body, if there is virus there, if somebody is positive for COVID-19. And the test measures specifically the amount of viral DNA, the essence of the virus. And that determines the viral load, so to speak, but whether or not COVID-19 is present. So when people say testing, they're talking about whether COVID-19 itself is present in the body. Antibody testing is an assessment of whether the body mounted a response in the past to being infected or affected by COVID-19. So a very different scenario. The reason the antibody test is important is that it helps us understand, for those people who are otherwise without symptoms, did they mount a response that can help us understand how many people have actually mounted a response. And this discussion about herd immunity, the greater number of people that are protected against the virus, the less opportunity the virus has to spread. So two different kinds of tests. The important thing is that, as our director said, the antibody tests that have been placed on the market are neither sensitive nor specific or accurate at this time. I understand that one lab has developed a test, the Quest lab, that evidently is fairly accurate and sensitive, but it costs $119 unless somebody has been verified to have had COVID-19 and their doctor wants to have them assessed for that test. So I would say testing. Yes, I believe that we should do as much testing as possible. Antibody testing, jury is still out. We have a lot more to learn. No accurate tests are available as of yet. So people should have patience with regard to that.
Thank you very much. Excellent, excellent review. Very good. Anybody else would like to ask a question to Susan? Susan, we're going to be asking you a bunch in just a minute or two. So if not, can I have a motion to approve the Director of Public Health report, which includes her reports from the other staff?
So moved.
So moved. Or second.
So it's Wayne Salzman moved, David McSweeney second. Libby,
Aye.
Libby, David,
Aye.
Wayne,
Aye.
Mary Beth,
Aye.
and I'm I 5-0. Thank you very much. It may be a good time, just as we now get into the discussion for COVID-19 response and update. We've mentioned the Medical Reserve Corps multiple times. I want to just list the names of people who have been so helpful from the Medical Reserve Corps. MRC nurses and public health individuals doing contact tracing. Thank you to all of these people: Connie Rayner, Lucy Miller, Heidi Mover, Francis Medaglia, Anna Reisman, Ann Henry, Tony Dadino, Carolyn Abruzzo, Beth Moon, Deborah Frost, Erin Spiropoulos, John Eastman, and Nicole Ritterhouse. School nurses who are town employees who are doing contact tracing for the board: Rosemary Pascal and Jessica Erin. And we also have some non-medical volunteers who have done a lot of transportation, runners of paperwork, who are also members of the MRC: Roger Morrison, Janice Leahy, Rita Shaw, Anna Carwan, Bill McCarthy, Pooja Singla, Madison McDonald, Sumaya Abrar, and Jean Perry, and also a town employee who assisted the Board of Health from Conservation, Eileen Coleman. All of these people, above and beyond, they have helped this town, and I thank you very much. We'll go to COVID update now, and I'm going to call upon uh, Wayne Salzman, Dr. Wayne Salzman, for some comments.
If I can get back. Here we go. Here we go. Can you hear me? Can you hear me?
Yes. Yes,
Okay.
we can.
Thank you. So, Mr. Chair, first off, let me apologize again for being late. COVID-19 presents issues to all of us, and I apologize for being late to this valuable meeting, and I apologize to the community. Mr. Chairman, I also want to thank you for allowing me to represent the board in supporting our community for weekly updates to the Burlington Cable Access TV station. I think I did my 5th or 6th update. I do them every Friday afternoon. Kudos to Jen and Robert for setting things up and allowing me to give my brief update. I don't know if they're of value. I hope that they are, but it's a privilege to represent the board in that fashion. So I thank you for allowing me to do so, and I appreciate the board's support in my doing so. We talked about testing, so it's one of the things that I wanted to talk about. So otherwise, I wanted to mention briefly clinical trials. I think that we're all aware that the remarks about disinfectants and sunlight and ways to internalize those things are not appropriate and should not be considered as any type of appropriate treatment for COVID 19. Please, please do not use disinfectants or any other equivalent type of material, uh, ingesting or otherwise, in the thought that it's going to protect or reduce your risk for COVID 19. Absolutely inappropriate. Absolutely. That being said, there are clinical trials, appropriate clinical trials currently ongoing using medications to see if specific medications can be of value. The medications that we've heard about commonly, for example, hydroxychloroquine, have not borne out the way initially thought by the COVID 19 task force out of the White House. But there are other trials, other medications being looked into. People may have heard that a common over the counter medication for uh, heartburn, or the medical term dyspepsia, also are being evaluated. I believe that there has been a lot of advisory information saying that one should not go out and purchase these medications. That is not appropriate. They are being studied to see if they are of value. Science, science, science is going to pave the way in helping us understand this virus and being able to treat this virus. And as I said in last Friday's segment on BCAT, we all need to be patient and understand the science is coming. My next topic is vaccine. We're all concerned about when the vaccine is coming, and if you listen to some folks, vaccines really have taken years, but it's definitely been ramped up, and there should be something, from my understanding, by next year. But this again is patience. Vaccines are unique types of medications or treatments. They need to be proven safe. They need to be proven effective, and they need to be configured, made in large quantities at any one time. It's a process. It takes time. Right now, there are studies going on throughout the world on safety. That's the first step, making sure that a vaccine is safe. Being effective and being be able to be produced in large quantities comes next. It's going to take time. So people need to be patient. There are many models folks have heard about regarding the pathway of this illness and when it is going to peak. According to the major model that's being used out of the University of Washington, it was supposed to peak tomorrow, but may have actually peaked a week ago. And if you heard our governor today, there's been stability in cases over the past 12 days or so. I think we have reached our peak in Massachusetts, and I'm sure it's going to decline. But that means that people are still going to become infected. They're still going to be susceptible for infection. They're still going to be going to the hospital. And sadly, they're still going to die. But those numbers should be going down. That being said, in order to help that process move along and perhaps not be as significant as it might have been otherwise, we still need to be responsible. We as citizens, as members of our community, we still need to be responsible to each other. So that means masks when you're in public. I see folks who are not wearing masks, and I'm thinking, really? Really? We should be wearing masks, protecting ourselves from others. Hand washing, hand washing, hand washing. If that has not become a daily routine for everyone in this country, if not the world, I don't know when is a more appropriate time. Protecting your coughs and your sneezes, that should be habit by now. And disinfecting or cleaning common surfaces in your home is key. I have to tell everyone that I firmly believe that social distancing is going to be part of our lives for quite some time. You may have heard on the news today that there's another model that comes out of Mass General Hospital, the Mass General Hospital Simulator model, which has looked at reducing our focus on mitigating this virus on May 25th versus reducing our focus on mitigating this virus into August. And it shows that on May 25th, if we just say, okay, time to go back to work, time to resume our lives, we know that by July we'll be back in this case again. Obviously, August may not be possible unless we're smart, unless we're good citizens. I believe that our state government is doing things appropriately, and we have a lot of good models that we can follow, role models, so to speak, of how to help mitigate this illness and reduce its risk for spread. The Board of Health has information daily. Our director, as you heard, is doing a wonderful job at helping us mitigate the spread, but we all have to be responsible. This has to be a community effort. I think that's it, Mr. Chair, unless there are any questions that I can answer from the board.
I'll open this to the board, or if anybody is watching that they have a question, please dial in. Thank you, Wayne. I really appreciate. I ask you to do this every meeting, and thank you so much for not only your science but also your wisdom. Thank you so much.
Pleasure. Thank you.
Susan, we have heard from you many times. I talk to you more than I talk to anybody else in my life. We're on the phone every day, and especially at 4 o'clock is the long call. Susan, I asked you if you had specific questions that you are receiving over and over again from the public. You mentioned one about antibody testing that we've talked about in the past. Are there others that you continue to receive? I know I'm not putting you in the spot because I warned you.
Yes. Okay, thanks. Yeah, so another one that we're continuing to receive is around essential businesses. Mainly, is this business supposed to be open, or I am working at this business and they're not practicing social distancing, or sometimes it revolves around the way the employee is being treated. So if it's if it's the latter, then there is a number that people can call. We put it up on our website. It's the Attorney General's office, and it's a hotline that they can call if they have any questions or concerns. So that's something that Christine had worked on. And if it is about social distancing, we have been calling the companies and talking to the management and asking them what they are doing, what their plans are, going over their practices with them to make sure they are practicing safe practices in the workplace for their workers. So we've gotten a few calls on that. One of the other things that we tend to have gotten calls on is masks, mainly about people wearing masks in public or employees not wearing masks. If it's an employee not wearing a mask at a grocery store or a pharmacy, like Christine had discussed, in the governor's orders, it says that grocery stores and pharmacies need to take measures to protect their employees and the public, and we consider wearing a mask a measure that they can take to protect employees and the public. So we have told them that their employees need to wear masks. So we have also reached out to them and told them, because sometimes they say, well, we don't have any masks. Right now, thanks to our MRC volunteers, Janice Leahy and Sandra Whitecross, we have masks, cloth masks that we can, or face coverings that we can give them so that they can hand them out to their employees. As far as mandating this for the public, you've probably heard that some other towns have done that. We have not done that, as you know, in Burlington. That is not something that I would recommend at this point. Everywhere I go, I see people with masks on now. I don't maybe occasionally I see people without them, but mandating it and enforcing it, the difficulty of enforcing that could be huge. So that's why I would not recommend that at this time. I think the best thing is to ask people to do it and let help. Hopefully they will understand that this is the right thing to do. It's a guidance at this point in Burlington, and that's what we're telling people. Not mandated in Burlington right now. That's something that the Board of Health wanted to do. They could discuss that, but right at this point, we're telling people it's not mandated. You cannot force someone. I mean, I suppose you can find them, but the difficulty would be we can't be everywhere to see who has a mask on and who doesn't.
Yeah, I mean, Mr. Chair, if I could just add, you and I spoke about this, and I think I've talked about this issue of masks with the director as well. We can't enforce this. I don't understand personally, given the information we have, especially out of New York, the devastation there, that folks would not want to protect their neighbors, and so we can't enforce people wearing masks. The town of Reading, I think just put that order in place. Um, you know, I just really hope that people just out of respect for our community, our very special community, just understand that we're all in this together and we need to help each other. I don't know what else to say, but I am not one for saying I would not advocate the board making a mandate to wear masks. We just cannot enforce that adequately. That is my opinion.
Are there any other questions? Or Susan, first, is there anything else you'd like to report on? You've reported on quite a bit tonight.
Yeah, I think that's it. Thank you.
The board, we've heard from Wayne. I'll go through the board one more time. David, is there anything else you'd like to ask or like to comment before we adjourn tonight?
No, I think that's it. I just, kind of reiterate Dr. Saltzman's words around requiring, and Ed, you and I talked briefly about this as well, of masks. In that, I'm an advocate, a strong advocate of everybody should be wearing masks out in public, including workers as well. And Wayne, hear on some of your comments, right? It's like, how can people go out in those types of situations and not be wearing masks, not being extra cautious, and not making sure they're protecting their fellow residents, right? Because they are all of our neighbors. So totally encourage it. I think, the other side of that, right? How do you enforce it, and why put an order in place that can't be enforced, or it's very difficult to enforce? And also, one of the things that we've certainly talked about in the past, I'd be afraid of residents taking kind of the law in their own hands, right, and having these ad hoc vigilantes out there, or causing larger disturbances based upon an order that we, haphazardly put in place. So while I agree with the sentiments that everybody should be wearing masks out in these public areas, until we know a better way to manage that and ensure the safety, we don't want to fix one problem and cause other problems. I think I like the stance that we're taking as a board at this point.
Thank you. Mary Beth Welch, anything else?
Yep. I agree with, thanks, Susan. I really appreciate, I'm sorry, I jumped back in the meeting, but I hope I got across, really proud of you and your staff. And thank you so much. And I appreciate that you do such a wonderful job in keeping us informed as well. I agree with the mask. I think you've also provided an an opportunity for residents, if they do not have one, right? If they don't have one, they're not sure, they don't want to make their own, but that we have so many. I have seen so many people on, even that we have a resident, we have multiple pages in the town, on like a Facebook page, and so many people are making them and offering them. So I think there's just so many ways to get that out there. And you said it best. They can certainly call the Board of Health if they're looking for, a supply or need one. So I think it's great. I think we're, as you said, helping our neighbors and helping our families stay safe. So that's it. Thank you.
Thank you. Libby, are you still on?
Here, I agree wholeheartedly with the wearing of masks out in public. And I also agree that there's potentially a problem of not having them. I can understand that as well, but it's a very necessary thing. But mandating it is not necessary. I think that the enforcement would be just impossible. So do the best you can. And if you wash your hands, that helps a lot too. So I do want to thank the staff for all that they're doing. It's a huge undertaking to master or take charge of this situation. And I'm truly appreciative for what you do. And also thank you to the board for the things that we do as a board.
Thank you very much. I'm going to close with a couple of things. For more than a dozen years, the Board of Health has established a medical reserve corps, 180 medical and non-medical individuals who've come together, who drill multiple times a year just in case. This town is blessed because just in case happened and continues to play out. I also feel that we're blessed with a wonderful staff on the Board of Health. I can't say enough about my Board of Health staff, our director, and everybody within this community who has helped out. And lastly, I cannot without mentioning, I must mention the Board of Health. A lot goes on behind the scenes. I want to thank Libby Wallenjevich. I want to thank Mary Beth Welch. I want to thank David McSweeney. And I want to thank Wayne Salzman for all that you do for this community. There's a lot of misinformation out there. If you want reliable information, go to the websites that we have placed on the Board of Health page. Please be safe, please be smart, and please be well. I'm going to ask Sarah, is there anybody on the line that would like to speak to the board?
None that I can see.
Then I need a motion to adjourn.
So moved.
And a second, please. David,
Aye.
Christine, I'm sorry, Wayne, rather. I jumped up. Christine, I just promoted you. Mary Beth Welch,
Aye.
did I miss
Libby.
anybody?
Libby.
Wayne?
Aye again.
Libby.
And I.
Libby.
Thank you all. I'm sorry?
You
I
forgot
did
Libby.
ask for Libby.
Oh, did you?
Libby,
Oh, okay. I'm
I
sorry.
did ask, yes. It's not easy.
You didn't ask me twice. Wait a minute. You didn't ask me twice.
Hallelujah.
I didn't. Hallelujah. Listen, everybody, please be patient. This is new for all of us. It's not easy doing it remote. And with that, be well. Good night.
Good
You
night,
too, Ed.
Good
Thank
Right.
you.
Thank you.
everyone.